The first slide that you have in front of you, it gives you a picture of what's happened with the state budget over time. And you can see this is the GIC, Mass Health and other health insurance coverage. So since fiscal year 01 to fiscal year 14, there's a pie, that's the state budget. And health insurance is now taking up a bigger portion of that pie, while other things have gone down, such as local aid has dropped 50% over that time as a proportion of the state budget. So I think this is an interesting slide to sort of see, get a context of what's happening with the state budget overall. And then why are healthcare costs going up so much? Our newsletter, I always include articles on what's happening in the healthcare industry, but big disparities in costs of care, as far as one hospital may cost vastly more than another hospital, primarily because of clout. Hospitals are 1/3 of healthcare dollars. In Massachusetts, the per admission rate ranges from $6,500 to $19,000 for the exact same service. So big disparities in hospital costs. Partners Healthcare obviously has large clout in the state, and they are 40% of the provider market, and they command higher costs as a result. The other big difference in healthcare costs has to do with what physicians are paid. The average salary for an orthopedist is $900,000, $700,000 for neurological surgery, whereas a PCP earns on average $200,000. So big differences in what folks are paid. Costly technology, provider group consolidation, rising specialty drug costs and usage, and an aging population are all contributing. And Mass is per capita healthcare spending is 36% higher than the national average. So what are other employers doing? Target and Home Depot and Trader Joe's have eliminated benefits for part-time employees. Retiree benefits, definitely a thing of the past. Right now, only 14% of employers offer retiree benefits. The deductible, we certainly had a huge backlash when we implemented the deductible back in 2010. We've all heard the complaints. People don't like to pay the deductible, but the $250 looks pretty nice compared to the average large employer of $666. And right now, 38% of Americans have a deductible of $1,000 or more for an individual. So a big change in cost shifting to enrollees. Unhealthy behaviors. CVS and Mass Hospital Association are actually charging higher premiums to their employees who are smoking or who are overweight. Another trend. And then spousal coverage. We at the GIC are seeing a big uptick in folks coming onto the GIC's coverage because the spouse's employer is no longer covering the spouse. Back in August of 2012, the Healthcare Cost Control Chapter 224 became law. And what this did was it encouraged adoption of new ways of paying for healthcare, and the GIC and the Medicaid program were actually directed to start paying for healthcare in a new way. So what we did was implement the Centered Care Initiative. And what we're doing is, with our 5-year health insurance contracts, we are actually looking to not only contain healthcare cost increases, but actually start bending the curve downward. And we are having our health plans work with providers on new ways of paying for care. Sometimes you've heard of it as an ACO. So we're looking at more global payments for care of patients. And the gains and losses are shared with the plans and then the providers to help manage dollars more efficiently. And so we were really pleased. This is our first full year. We came in with an overall 1% premium increase. 1.4% for the non-Medicare plans, and this is very favorable compared to other employer trends, which are 2.1% in 2014, 5.2% in 2015, and those are with benefit cuts, higher deductibles, elimination of some of those benefits I mentioned. So the Centered Care Initiative, the last newsletter, we highlighted the first three features of the Centered Care Initiative, and that's more designation of PCP, coordination of care, sharing data so that your doctor knows the prescriptions that not only he or she has prescribed, but all of the other doctors, what they have prescribed, tests that have been done on you. Low-cost providers, continuing to encourage that. Expanded hours and urgent care access. It's a big problem. If your doctor's office closes at 4 and you have a sore throat, often your only option is to go to the emergency room. And we're trying to encourage providers to have longer hours so that those kinds of urgent care needs can be handled at the doctor's office. High level of care for chronically ill, disease management, group visits. Where this may come into play is wellness. So if you have a diabetic patient or somebody that's had coronary artery disease, they would meet in groups to learn about healthy behavior, how to eat healthy, how to exercise, and those types of things to work together as a group to improve behavior. So our plan benefits help support this initiative. All plans will be reaching out to members to acquire PCP information, and our health plans will talk about what they're doing during annual enrollment to acquire PCP information. One of our plans is going to offer a copay incentive for visiting a Centered Care PCP, and the plans will continue to tier specialists based on quality and/or cost efficiency. So Tier 1, Tier 2, and Tier 3, which you're all familiar with. We're implementing a number of benefit changes that are related to federal health reform. So as of July 1st, there's not going to be any dollar limit on wigs, no dollar limit on low protein foods, no dollar limit on medically necessary early intervention services, no dollar limit on in-home dialysis, and no dollar limit on speech therapy. There are, obviously these are for certain types of conditions. For example, wigs are usually for somebody that's suffering from cancer, for example. So there are restrictions that apply, but this is a lifting of the dollar cap that was on these benefits. The bigger benefit that's going into effect July 1st is the cap. And what this means is all of your deductibles, co-pays, co-insurance, there used to not be a cap. Now it's $5,000 per individual or $10,000 per family as of July 1st. For our insured plans, which are the two Fallon plans, Neighborhood Health Plan and Health New England, it will include prescription drug costs. For all of the other plans, it won't include prescription drug costs this first year, but all of the plans it'll provide include medical and mental health benefits. So no person, and there are very few people that actually exceed this. We do an analysis every year on this. Generally, the folks that have exceeded these kinds of maximums have been people seeking mental health services down in Florida, for example. They go for treatment in Florida. That sounds like a nice deal, and they're going out of network, and those are the people that have been exceeding the maximum, or people that are getting high-cost, non-preferred drugs. Again, very few people, but it is a protection that is going into effect as of July 1st. So the other minor benefits that are going into effect as of July 1st, Fallon will be expanding its FITS Health Club benefit. Neighborhood Health Plan is no longer going to be tiering primary care physicians. It's going to be a flat $20 copay, which is in keeping with what we're trying to do as far as PCPs are the center of the care. TEFS Navigator and Spirit, the plan used to tier hospitals based on different types of services, adult medical surgical, OBGYN and pediatric. Now a hospital will be tiered either Tier 1 or Tier 2. The Unicare plans, for folks that have certain high-risk conditions such as arthritis, multiple sclerosis, and immune diseases. They will have to get their oral, injectable, and infused specialty drugs through CVS Caremark specialty drug. In the past, they could get it through either Unicare or CVS, and now they will get it through CVS Caremark. Those employees and retirees are being written to by CVS Caremark to explain this new change that's going into effect July 1st. And then for Unicare Plus, members are going to pay a lower copay if they visit a PCP, that's a centered care PCP. So when you bring up the provider directory, you'll be able to see who is a PCP centered care. During annual enrollment, you always want to encourage employees to take a look at their options, make sure that not only their own doctors and hospitals, but their spouses' doctors and hospitals, or their kids' doctors and hospitals are in a plan's network. The choice is binding. So once you join during annual enrollment, if that doctor or hospital leaves the plan during the year, the member has to find another participating provider. They can only change health plans during annual enrollment. I know for some of the folks out here, North Adams Hospital unexpectedly just closed. That, you know, everybody's been scrambling on that. And in your packets, you have a grid of all the hospitals that are in the limited network plan. North Adams is obviously on that grid. There are really only two plans that have had North Adams Hospital, the limited network, not the wide network, the limited network plans. And those were Health New England and Harvard Primary Choice. Health New England has Berkshire Community Health Center in its network, so it's not an issue for people. Harvard Primary Choice people, they don't have Berkshire in the network, but those people do have access to a hospital that's in Vermont, right over the border, and they can access care there. But during annual enrollment, those people would definitely want to look at where they want to seek care. Maybe they want to seek care at Berkshire, but maybe they want to go to Springfield or wherever. So again, people always want to evaluate their options during annual enrollment, see if their doctor and hospital is in the network, and take the opportunity during annual enrollment to check out that information and also check the doctor and hospital tiers. So I'm going to walk you through, especially we've had a big turnover in coordinators. A lot of lucky people are getting to retire, and we will be touching base on retirement because that is one of our most frequently asked questions. We're at a health fair and they always, you probably haven't heard of this, but I'm turning 65 or I'm retiring. Oh, I've heard it. I'm not there yet, but I have heard it. So we'll just sort of walk through our different health plan options and have the health plans come up and speak to some of the things that are going on during annual enrollment. So we have 11 plan options, 12 if you count Unicare Basic with and without CIC. We have the indemnity plan, which is any doctor, any hospital, anywhere in the world. PPOs, which have the highest benefit level in network, but there's also out-of-network benefits. The EPO, which is similar to an HMO, except referrals aren't required with a PCP, and HMOs, which are in-network benefits also only, except for emergency and urgent care. We always like to start with this map. We find at the health fair it's kind of an easy way to start on where you live determines which plan you may join. So for example, in Berkshire, you can see that Primary Choice and Spirit are in a different color than the other plans that are listed there, and that means that they have a limited network in that county, so you can join, but you want to make sure your doctors and hospitals are in that plan. That's just one example, but the different color coding sort of helps draw your eye to whether it's full-blown coverage or partial. But even if it says full-blown coverage, it doesn't mean that every doctor and every hospital is in a particular county. It just means that according to the Division of Insurance, there's wide coverage in that county. But it's a good place to start. So where you live determines which plan you may join. So if you live in Connecticut, if it's really along the border of the state that there's some coverage for the Independence Plan, Health New England, Navigator, and Plus. But really, when you start moving into the state, if you're down in Hartford, for example, basic is really the only plan for you. So it's just a good place to start to weigh your options. So our limited network plans are a great value, and they're a great value in that their premiums are 20% less expensive than the wider network plans. And the reason is that even though their benefits mirror the wide network plan, there's fewer doctors and hospitals in the plan. So again, we've had a lot of situations where an employee has made sure that his own doctors and hospitals are in the network, but he never stopped to think about his wife or his kids and whether their doctors and hospitals in the network. So again, make sure you emphasize with your employees to make sure that the doctors and the hospitals are in the plan, and make sure they check the tiers. Those can change each July. So Fallon Health, Fallon actually has changed the name of the plan. It used to be Fallon Community Health Plan, and now it's Fallon Health. Fallon Health Direct Care has the PCP and referrals. The service areas Bristol, Essex, Middlesex, Norfolk, Plymouth, Suffolk, Worcester, and some coverage in Hampden and Hampshire. There are 26 Mass hospitals, 5 Peace of Mind, and that's for second opinions. And it has a very attractive premium cost. Fallon Select Care is Fallon's wider network plan. This is also an HMO. The service areas Berkshire, Bristol, Essex, Franklin, Hampden, Hampshire, Middlesex, Norfolk, Plymouth, Suffolk, and Worcester, and there is some coverage in New Hampshire. So there's 76 hospitals in Mass, now 75, but just from a relative standpoint, I'll stick with the 76. 69 hospitals are in this plan, so it's a fairly wide network plan, and the premium cost is similar to our PPO options. The Harvard Pilgrim Independence Plan is one of our 3 PPO, truly PPO type of plans, where all the Massachusetts hospitals participate. This plan has 3 tiers on the hospital side. The service area is all of Mass, Maine, New Hampshire, and Rhode Island, with some coverage in Connecticut, New York, and Vermont. And specialists are tiered based on quality and/or cost efficiency. And then Harvard's limited network option is the primary choice plan, which is an HMO. The service areas Bristol, Essex, Franklin, Hampden, Hampshire, Middlesex, Norfolk, Plymouth, Suffolk, and Worcester, and some coverage in Berkshire. So the benefits and copays match Independence Plan, but there are 55 hospitals in this plan's network. So the Tier 3 hospitals are not in this plan. And then Health New England, most of you are familiar with this plan, Western Mass-based plan. Service area Berkshire, Franklin, Hampden, Hampshire, and some coverage in Worcester. They are in the process of expanding in the Worcester area, so the coverage in the Worcester area could increase. 18 Mass hospitals, a very attractive premium cost. It's an HMO. Neighborhood Health Plan is an HMO. No out-of-network benefits except for emergencies. This service area is Barnstable, Bristol, Dukes, Essex, Hampden, Middlesex, Nantucket, Norfolk, Plymouth, Suffolk, and Worcester. 57 Mass hospitals, and a very attractive premium. Tufts Health Plan Navigator is the second of our PPO options. Also very wide network. All of the Mass hospitals are in this plan. The service area is Mass and Rhode Island, and there's some coverage in Connecticut, New Hampshire, New York, and Vermont. This plan does have Beacon Health Strategies as the carve-out, and we'll be talking about Beacon Health in a few minutes. And this hospital has 2 tiers on the hospital side. And then their limited network option is Spirit, which is an EPO plan, so there are no out-of-network benefits. It's just like an HMO, except you don't need to get referrals from your PCP. Service area Barnstable, Bristol, Essex, Franklin, Hampden, Middlesex, Norfolk, Plymouth, Suffolk, Worcester, and some coverage in Berkshire and Hampshire. 53 Mass hospitals, so it gives you the context, 53 hospitals versus the 76 for the Navigator plan. Then our Unicare Basic is our most expensive plan, because this is the plan that you can live anywhere, and if you do live in Colorado and you're not a full-time student, this is the plan you need to be in. and you can live in France, which we do have folks that are living overseas. So this is our most expensive plan. It's every doctor, every hospital. We always recommend that members elect with CIC. Unfortunately, CIC is on the state side a enrollee pay-all premium, but it really is helpful to make sure that they have that comprehensive coverage. CVS Caremark is the drug benefit manager, and Beacon Health is the mental health carve-out. So this is with and without CIC, gives you why the enrollee would want to elect with CIC. So for example, a physician visit would be covered at 100% if you have CIC. If you didn't have CIC, you'd only be covered at 80%. So it'd almost be like being in a PPO plan and going out of network. Imaging, same thing, 100% versus 80%. Outpatient surgery, 100% versus 80%. And that's where the dollars are. So you really want to make sure your employees are taking it with CIC. The Unicare Community Choice is a hybrid plan because every Mass physician is in this plan, but where it is limited network is on the hospital side. So there are 53 hospitals in this network. This has an extremely attractive premium. The service areas: Barnstable, Berkshire, Bristol, Essex, Franklin, Hamden, Hampshire, Middlesex, Norfolk, Plymouth, Suffolk, and Worcester. And CVS Caremark and Beacon Health Strategies are the carve-outs. And then the Indemnity Plus is very similar to Navigator and to Independence. This is a PPO type of plan where all of the hospitals are in the network, and there are 3 tiers, similar to the Independence plan. The premium cost is similar to those 2 plans. Carve out CVS Caremark and Beacon Health Strategies. Service areas: Mass, Maine, New Hampshire, Rhode Island, and some coverage in Connecticut. So I mentioned that Beacon is the carve-out for all of the Unicare plans, and Tufts Navigator and Tufts Spirit. What this has is a network of providers where there are in and out of network, similar to a PPO plan. We have comprehensive benefit grids, so there's actually 6 different grids depending on which plan you're in and whether you're an RMT and EGR, which folks here don't need to be worried about. But it's so if you're in Tufts Spirit and you're looking at Beacon Health Strategies, there's a grid that gives you all of the benefits for mental health and substance abuse on our website. So definitely, if you have employees that mental health is an important benefit for them, you'd want to look at those grids, and Beacon will have those at our health fairs. This is the plan with the EAP benefits for individuals, which is a very nice benefit to have. So often, if you're under stress, you're going through divorce, bereavement, those types of things, the first 3 visits are free. There's no copay, which is nice. And they have the legal service and the financial service consult, which is another nice benefit to know about. So this is just to make sure we're going to have Sue Cooper at the end. That's the EAP benefit for agencies and municipalities to come out and speak to your employees. But if you as an individual need EAP services, the Tufts and the Unicare plans are the ones with the EAP benefits. So our prescription drug benefits, all plans have the 3-tier copay structure. We definitely recommend mail order for people that have chronic conditions, whether it's high blood pressure or cholesterol, asthma. That's definitely a great way to save some money on your copays, is to use the mail order. And then some of the plans, here again, if you have an employee who, prescription drugs is a big concern for that employee during annual enrollment, he or she should do their shopping as far as plan to find out what tier their drugs are on and what kinds of programs the plan has in effect that may affect their benefits. So, for example, some of our plans have step therapy. Others have mandatory generics, which means that in the event there's a generic medication available and the person wants to take the brand name, they would have to not only pay the difference in the copay, but also the difference in the cost of the drug, which can be very expensive. Specialty drug pharmacy, where most of our plans now, if you are taking specialty medications for some of those extremely expensive drugs for complex conditions, I mean, you need to use the specialty drug pharmacy, and they will ship the meds either to your doctor's office, to your home, wherever you want. And then the maintenance drug pharmacy selection, this is a nice feature where Tufts and Unicare both are using CVS Caremark, and if you want to get your maintenance meds at a CVS pharmacy, you can get the maintenance med at the mail order copay. So full-time students, these are the only people that can live outside of the service area and stay in the same plan. So if you have a full-time student who graduates, or you have a kid who is moving to California because he or she is, I don't know, becoming an actor or something, and they want to stay on your plan, you as a family need to move to the Unicare Basic Plan if you want to continue to cover that dependent. So otherwise, they need to, if you have a full-time student who is living outside of this plan service area, they need to fill out that dependent age 19 to 26 form, and we need to have it coded in our system that they're a full-time student. So our plans will talk about the differing benefits they offer for full-time students, and again, during annual enrollment, it's a good time for employees to, especially if they're covering kids, dependents 19 to 26, to sort of see what the differences are between the plans with providing care for those kids. So I'm going to have all of our plans come up and talk about these various issues. One of the reasons, so you'll see on this, I put physical therapy just as for this year we're talking about physical therapy, but really any of the benefits that don't appear in our benefit decision guide, and there are many benefits that don't appear in the benefit decision guide, because then it would be a plan handbook of 85 pages. So if you have an employee that has any particular needs, whatever that is, he or she should be doing their homework during annual enrollment to find out about those kinds of benefits. So I mentioned prescription drugs, for example, or mental health benefits, for example. And now on this plan panel, we're talking about physical therapy just as an example of another frequently used service that people have need for, and there are slight differences between the plans. So I'll let each plan introduce themselves and speak a little bit about these topics.
Good morning, everyone. I'm Glenda DeBarge from Health New England. Health New England continues to be one of the limited network options for the GIC through the first plan, which is our active HMO, and then the Med Plus, which is a retiree option for those with Medicare. You do have to reside in our service area to join the plan, and our service area is primarily here in Western Massachusetts in the counties of Berkshire, Hampden, Hampshire, Franklin, and parts of Worcester. We are working on expanding our coverage through Worcester, but we don't have that finalized as of yet. But as soon as that's finalized, I will make sure that all the open enrollment materials are updated. We have 2 new hospitals in network in the Worcester area as of March 1st, Clinton Hospital in Clinton, Mass, and Health Alliance in Leominster, Mass. So those are in plan, Health New England in plan hospitals effective March 1st. For the centered care providers, Health New England will have the primary care physicians with the logo, the centered care logo in our directory, as well as the online lookup. And there are 2 ways that Health New England obtains primary care physician information. When the enrollment feed is sent to us, we do send out letters to members asking them to contact Health New England and letting us know who their primary care physician is. Or they can go on to H&E Direct member portal and opt and select their primary care there. The second way is also through our the first primary care claim that we receive for that member, Health New England will auto-assign that PCP to that member. So those are the ways that we're capturing primary care physicians for our members. All members are covered because we are an HMO for emergency care and urgent care visits when they're traveling outside the service area. You do have to let us know when this occurs. That way we can flag the claim and have it paid as if it were in plan, which would be copay then deductible. For student dependents, we have additional coverage for those who reside outside the service area. If they have an emergency room occurrence, they're covered for additional services such as allergy injections, a follow-up visit to that emergency room incident, or outpatient rehab short-term services. Physical therapy benefit through Health New England does not apply towards the $250 or $750 deductible. It's a $25 office visit copay, and it's per visit per treatment type. And then we also have the wellness reimbursement of $150 for activities such as a Weight Watchers participation, gym membership, yoga classes, Pilates classes. If you have kids in town sports, you could have the $150 count towards their registration fees. And we do provide a 3-month grace period for getting the reimbursement.
Good morning. My name is Eric Jakes. I'm from Neighborhood Health Plan in Boston. For those of you who are used to seeing with Tora Finley, she hasn't gone anywhere. She's still with Neighborhood Health Plan. She's my manager now, so she's working alongside me with GIC. So a few things about Neighborhood Health Plan's network. We're based in Boston. We're still right in downtown Boston, where we've always been, right near South Station. So the majority of our members are actually in Eastern Massachusetts. We are very prominently in Central Mass, much less so out here in Western Mass, however. We recently modified our network of hospitals so that we were truly a limited network. So many of the hospitals that were in Western Mass, you notice that Cindy indicated that we had 57 hospitals in our network. Most of the Western Mass hospitals are no longer available to GIC members, so it's quite important that if your folks in Western Mass here are interested, that they go online to nhp.org and take a look at our directory effective July 1st, because there will be some changes in that network. So hospitals such as Athol, Memorial, Holyoke, Mercy, and Noble are no longer available to GIC members out here in the western part of the state. However, if you're here from Worcester, in Worcester County, we're contracted with UMass Memorial, Leominster Hospital, Haywood, Clinton, those hospitals all in Central Mass. With regards to PCP information for centered care, we do, when a member enrolls with NHP, what we do is we'll auto-assign a member to a PCP if we don't have any indication that they've been with us in the previous 12 months. What they'll do is get a letter with their card, and it will tell them exactly who the PCP is assigned to them, and it will give them an option to either go to My NHP, which is the member portal, or to call us to change their PCP. We've always required a PCP for NHP members, so this is nothing new, but we are definitely enforcing the aspect of PCP being the center of care for all members. With regards to out-of-network coverage, everyone is covered for emergencies and urgent care. That includes students. What we ask is for people to make sure that they're contacting their PCP or having their PCP contact NHP about the emergency and any follow-up care that will occur when they're back in the area. There's no difference for students. If you have a student who's going to school in Colorado, for example, or out in California, and they need to go to an emergency room for care, we certainly are going to cover that. We just have to make sure that the claim gets submitted to NHP and that the PCP and NHP are aware of that. Now, there are going to be situations in which somebody, say your student's going to the University of Aruba, and they go to an emergency room there, they may not have heard of NHP. There may be payment up front that needs to be made just because they don't know who we are and they've never billed us before, but then that can be reimbursed to the family who had the emergency services provided to them. For physical therapy and wellness benefits, we do have short-term outpatient rehabilitation following injury or illness. It's up to 90 days per condition, and for physical and occupational therapy, there's a $35 copayment for each of the visits. And then we have a number of different wellness benefits, including over-the-counter medication covered at a discount or free with a prescription from a primary care physician. We have a terrific smoking cessation and coverage of nicotine replacement medication. We have reimbursement for fitness membership, up to $150 per individual and $300 per family per benefit year. And then we cover items such as bike helmets and home safety products. We have discounts on childbirth classes, and we also have a free 24-hour nurse advice line for folks who need to call up any time of the day for advice prior to going perhaps to an urgent care or an emergency room. Thank you.
Good morning, everyone. My name is Caroline LeBlanc, and I work for Unicare. I am also a new face. For those of you that are used to seeing Debbie Frazier here, she has retired. As Cindy mentioned, lots of retirees. So let me tell you a little bit about Unicare. We have the basic plan with and without CIC, and our Medicare extension plan. On those two plans, you can use any doctor or hospital. There are no network hospitals or doctors that you have to use. So you can use anyone inside or outside of the United States. On the Plus plan, we do have all of the hospitals in Massachusetts are participating, and then we have the doctors tiered by, the specialists are tiered and the primary care physicians are not. The primary care physicians have one copayment and the Plus plan has the specialists are tiered, excuse me. On the community choice plan, you can use any doctor in Massachusetts. However, the hospitals are limited network hospitals. So there are 53 hospitals in the community choice plan that are participating. We had limited, really not a lot of hospital network changes. The hospital networks have remained fairly the same. The community choice hospital, we have 53 hospitals that are participating in our limited network of hospitals. And then on the Plus plan, they are tiered, Tier 1, Tier 2, and Tier 3. And all 76 hospitals in Massachusetts are participating. In regards to PCP information, at this point, we're not requiring members to have a primary care physician on file. However, on the Plus plan, we are incenting our members to use a centered care primary care physician. If our members use a centered care PCP, they'll have a $15 copayment to use that doctor. Out of state or out of network coverage for emergencies. If one of our members is having an emergency, a true emergency, they'd go right to the closest emergency room and have that service. If someone is seeking urgent care while out of the service area of their plan, we would require or ask that they use a travel access provider. That can be located on our website or by calling customer service. If they use a travel access provider, they have agreed to accept our payments as payment in full. So they would be similar to a contracted provider. Let's see here. Right, and so the travel access providers, by using a travel access provider, that will protect members from being balance billed. Outside of Massachusetts, providers, we don't have networks other than the travel access network. If they've contracted as a travel access provider, they have agreed to accept our payments in full. If they're not a travel access provider, they can bill the member however much they choose. So the member could be balance billed. Let's see here. And that would be the same for students. Again, if you have a student that is in an emergency situation, they can go right ahead and go to the closest hospital. If you have a student that's needing urgent care, not a true emergency situation, it is best to contact us for finding the travel access providers in their area so they have that full 100% coverage. Physical therapy on our plans is covered at 100% after a copayment of $20. The plan requires notification 1 day prior to physical therapy starting, and the benefits are based on medical necessity. Our wellness benefit, the wellness benefit on the Unicare plan is a $100 benefit per family. We also offer several discounts that are available on our website, which are discounts for Weight Watchers Online, Jenny Craig, acupuncture, massage. That's not a plan benefit, but it's an additional benefit that Unicare offers our members.
Good morning, everybody. My name is Elaine Wilson, and I'm with Harvard Pilgrim Healthcare. It's nice to see a lot of familiar faces this morning, and thank you. I'll try to be quick because I know you have a lot to listen to this morning. We have 2 plans that we're offering for active employees and our Medicare Enhanced plan. Very quickly, for Medicare Enhanced, a member may live anywhere in the United States. So for that plan, the enrollment or service area is anywhere in the United States, and members are covered worldwide for any services that they might need. If they're lucky enough to travel while they're retired and they're in Italy and need stitches, they'll be covered for that. So folks on Medicare Enhanced may travel anywhere in the country, and they may travel anywhere in the world, and they may live anywhere in the country. For our independence plan, as Cindy mentioned, the enrollment area is our entire service area of all of Massachusetts, all of New Hampshire, Maine, Rhode Island, and the bordering towns in Connecticut, New York, and Vermont. Over the ensuing months, you'll be hearing about our expansion into Connecticut. At this time, the enrollment area hasn't changed. As that expansion area increases, folks will be able to live deeper and deeper into Connecticut. For the moment, the traditional enrollment area continues. For the primary choice plan, which is our limited network plan, the enrollment area is Massachusetts only, not including the Cape and the islands. So it's truly mainland Mass. And that does include the border towns of the other states, of course, but folks need to live here in Massachusetts to be enrolled in the primary choice plan. For the hospital network, the network has remained very stable. There is one change in our tiering that results in a change in the primary choice network, and folks want to look very closely at primary choice network because Bay State Franklin is no longer part of primary choice. It's now a Tier 3 hospital, and Tier 3 hospitals are excluded. And with the situation at North Adams Regional, folks will definitely want to take a very close look at the network before they make a decision to join the limited network plan. Otherwise, the independence plan is a great fit because all of the hospitals are part of the plan. For primary care information, on the HMO, folks are required to have a primary care doctor. We won't know who that is when they enroll, but we will ask that they call us or go to our website to elect a physician, and we will auto-assign them a physician as well until they have gone through that process. For the PPO, as part of the Centered Care Initiative, we will be asking folks who their primary care doctor is, but we will also be letting them know who we think is their doctor by virtue of their claims history with us. So we'll send them a letter saying, we think your doctor is Dr. So-and-so. If that's correct, you don't need to do anything. If that's not correct, let us know either through the website or by calling us. That's how we'll be getting the PCP data. When folks are lucky enough to travel and they're out of the network, I mentioned on Medicare Enhanced, members may travel anywhere in the world. That's true for all three plans, and folks are covered anywhere if they become sick or injured, anywhere in the world. They do need to live in our enrollment area to be on the respective plans. If someone is traveling and has an emergency, we ask that they call us within 48 hours if it's possible for them to do so. In some instances that won't be possible, and we'll certainly understand. If someone is a full-time student and they are away, if they're a full-time student, a student may live anywhere as well. That is the one exception for the enrollment area, as you know, full-time students. And if you are a full-time student on the PPO, you may use coverage in a couple of ways. Most kids go off to school and they come home and they see their doctor when they're home, and that's fine on the PPO. That works for the HMO too. On the PPO, though, we do have a national network of providers. So if you've got a student who's going to school in California and would like to have an eye exam while they're there, they can do that and have coverage in-network with one of our participating providers. Or they'll have coverage out of network if they see someone entirely not affiliated with us with their deductible and co-insurance. Pardon me. With that student on the HMO and they're in California, they're covered if they have an emergency, if anything happens, if they become sick. They're of course covered for that while they're away. They can come home and see their primary care doctor for routine care. If there's something foreseeable that the child or student will need while they're away and their doctor knows of that, they can arrange for that for them as well, so they can continue their course of study in California and get treatment. If, for instance, someone came home at Christmas break and was skiing and broke their leg and they need to have physical therapy, they can do that away, but it needs to be authorized ahead of time. And speaking of physical therapy, if that benefit were in question for the student, the benefit for physical therapy is 90 consecutive days per illness or injury. So if I'm on either of the HMO or the PPO and I break my leg, I'm covered for 90 days of therapy from the time my therapy begins until the course of treatment is over, as many visits as I need within that 90 days. And if, being the clod that I am, I then fall and break my arm, I have another 90 days for that broken arm. So the benefit is per illness or injury with our plans. And as far as wellness benefits, there are a wealth of wellness benefits for Harvard Pilgrim members, from the fitness reimbursement to discounted eyewear and free eyewear to stress management, smoking cessation, chiropractic, and Tai Chi. There's lots of discount programs available for folks around wellness. So once the member's on the plan, if they call us or visit our website, they can find all of that information out as well. And it will be in the enrollment kits too. Any questions for Harvard Pilgrim? Thanks very much.
Good morning. My name is Jennifer Curcio. I'm here from Tufts Health Plan. Also with me in the back of the room is my colleague Christine Field, who manages the retiree products. So we'll be around afterwards, and if you have any questions on the retiree products, Christine is more than happy to field them. No pun intended, get it, her last name is Field. So anyway, sorry, I just thought of that. 2.5-hour drive, you thought I would have done it sooner. So we are happy to be offering our Navigator and Spirit plans. Our Navigator is our full network plan that covers all of Massachusetts, Rhode Island, some of southern New Hampshire, as well as the small border parts of Connecticut, Vermont, and New York. Spirit is the limited network plan. We cover mainland Massachusetts with parts of Berkshire and Hampshire counties, and it does exclude Martha's Vineyard and Nantucket. The big change this year for our hospitals is previously, as Cindy had mentioned earlier, we had a 3-tier system. So in other words, a hospital could have one copayment for adult med-surg, a different copayment for OBGYN, and then a copayment for pediatrics. We've collapsed those tiers, and it's just going to be one copayment per hospital, no matter what the service is. So it's a little bit easier, I think, to understand. It's a little easier to explain, quite frankly. So there's still 2 tiers on our hospitals. Tier 1 is the $300 copayment, and Tier 2 is the $700 copayment. Neither of our plans require a primary care physician. We are encouraging folks to let us know who their primary care physician is, whether they are on Navigator or Spirit. We are doing that through a variety of channels, through letters to our existing members, information on the microsite, as well as all of our open enrollment information has been updated to include information on both the centered care program as well as declaring your primary care physician. So that can be done via the website, tuftshealthplan.com, or also by calling the Tufts Health Plan GIC queue. That number is plastered everywhere, so members can call in. I've personally trained our member services staff on the GIC queue, so they know that folks are going to be declaring their primary care physician. So anytime you talk, if you can encourage people to let us know who their doctor is, that would be great. So out of network, you are covered 100% when traveling on both plans for any urgent or emergency care. You do just need to go to the nearest facility. And if you are admitted to the hospital, we do ask that you or someone on your behalf contact us or your doctor within 48 hours, if that's possible. Full-time students are also covered while they're living out of the service area for any urgent or emergency care. Routine care does need to be provided in the service area by a contracting provider. Our physical therapy benefit, it's 30 visits per calendar year with a $20 copayment. That is a short-term benefit. It's meant for rehabilitative only. We are continuing with our $150 fitness reimbursement for any fitness center. Just needs to have cardio and weight training. We've expanded that this year to also include group exercise classes like Pilates classes, yoga classes, and kickboxing classes. We are still offering discounts on massage therapy, acupuncture, discounts on dietitians, licensed nutritionists, Nutrisystem, and Jenny Craig. There's a whole bunch of information on, added benefits on the website, and also it's going to be in the open enrollment packets. Okay, so thank you very much for your time.
Good morning. My name is Julia LeBron. I'm with Fallon Health. We offer 2 different plans. Both are HMO plans. The first is our broadest network plan called Select Care, and that's, again, a network that spans all the way from the New York border all the way into Boston, steps down onto the Cape, and into southern New Hampshire. So it really does cover the majority of Massachusetts with the exception of a little part of the Cape. We then have the direct care plan. That is our limited network plan. And as we are out here in Western Mass today, I want to just make sure that you are all fully aware that the direct care plan really is a Central Mass, North and South Shore type plan. When I think of how far direct care comes here to the west, I would state that it comes steps up to Palmer. So I would think of the direct care plan as being available east of the Palmer area. Okay, so that's the two HMO plans. Both require an election of a PCP because to get to a specialist, you need to have a referral from your primary care physician. We do obtain those PCPs after enrollment. So as a member enrolls, we will send out a letter once a year around the July timeframe telling the members that they need to elect a PCP. They can go online or call our customer service department to make that election. We also make welcome calls out to any new members. So during those welcome calls, if we touch base with that member, we do ask them for that information at that time. Should a member not elect a primary care physician, if a service is rendered, a PCP service comes in, we do get daily feeds about these services, and at that point we will reach out and make sure that that primary care is elected as their primary care. So there are a number of ways in which that data is collected. Any hospital network changes? Really not a lot of network changes this year. On the Select Care plan, we do tier our hospitals. So the biggest change there is that this was the year that we reevaluated the tiering of the hospitals on the Select Care plan. So those tiers, you want to make sure that your members are looking at the updated list to ensure what copayment they will be paying effective as of July 14. For out of network coverage, we have urgent and emergency coverage worldwide. So when you travel, a member is going to be covered in any type of emergency or urgent care situation. Again, if outside of the United States, they may be required to pay for those services up front. They just need to obtain a copy of an itemized bill for their submission when they get back to the service area. If you do receive services in the United States on if you're traveling in California, we do encourage the members just to call us to let them know that they've received those services. Again, depending on the situation, it may be right away or generally if it's an inpatient admission, the hospital's going to call and inform us that they're inpatient. For full-time students, again, urgent and emergency care, the same aspect. They do have a little bit more extended coverage though for like any extended care. So when they're home during the summer or during their vacations, they should be receiving their routine or any planned care. I always give an instance of someone who has had a knee injury. They've had it for years, but they decide to go through some elective surgery. That elective surgery, because it is elective in nature, needs to be done while they're back in the planned service area. So they have it done, let's say, during the Christmas vacation. Then they go back to school in California. That student could get authorized for physical therapy services out in the California area because we do know that as a follow-up to surgery, PT is absolutely mandatory in order to heal correctly. So those are some of the certain instances in which they might be authorized outside of the service area. So physical therapy, subject to a co-payment. Again, it is 90 days per illness or injury on both of our plans. And with our wellness benefits, again, a whole host. We have a 24-hour, 24/7 Nurse Connect line. We have discounts on eyewear. We have our fitness reimbursement. Fallon calls it the It Fits program. Under Select Care, whether you're an individual or family, you get $100 each year. And on the Direct Care plan, the limited network plan, an individual would get $200 and a family would get $400. Fallon's plan has always included reimbursement for any fitness facility, Weight Watchers, but we've always expanded it into the school and town sports. So if a member has a child that dances or horseback rides or plays basketball, any sports programs or summer camp programs that keep them active, those services are also reimbursable under the It Fits program. It also includes coverage for or reimbursement for cardiovascular home fitness equipment. So if someone's going to purchase a treadmill or an elliptical, that too, those fitness dollars can be used towards those services.
I'm going to ask each plan to talk about any hospital notification requirements that members need to be aware of. For example, if you're giving birth to a child, and what the notification requirements are.
The example Cindy mentioned with the birth of a child, you do have to let us know within 31 days of the date of birth to add them onto the policy, and you would do that through your coordinator. Sorry, Health New England does not require you to notify us when you're giving birth. Usually we get notified by the coordinator that the child is being added to the plan, but typically, no, we don't need that notification.
If you are on the Navigator plan and you are scheduled for a surgery or a birth of a child with one of our contracting hospitals, you do not need to notify us. The hospital is required to notify us. If you are on the Navigator plan, you do have an out-of-network coverage. You have an out-of-network level of benefits where you can choose on your own accord to go to Johns Hopkins, right? And if you're going to be inpatient at Johns Hopkins, it is your responsibility to notify Tufts Health Plan. This is not urgent or emergency care. This is something that you've planned, and it's with a hospital that does not contract with Tufts Health Plan. So it doesn't apply to Spirit because that wouldn't be covered. It would only apply to Navigator, and it only applies to an inpatient stay at a hospital that is not contracting with us. If you do not notify Tufts Health Plan, there is a $500 pre-registration penalty.
With Fallon Health, any inpatient stay for maternity does not require an authorization, but outside of maternity, if you're going in for an inpatient stay, those services do need to be authorized. Again, we consider maternity, you don't really know when you're going to have the baby, so we kind of do consider it urgent, which is not why we do not require that prior auth before the
But
baby.
if you're, for example, you're having knee surgery.
But if you're having knee surgery, so if it's anything outside of maternity, if it's a scheduled inpatient admission, that service does need to be authorized.
Hi, and for Harvard Pilgrim, if you're on our HMO or if you're getting services within our network on the PPO, the member doesn't need to do anything if they're going to be hospitalized. If the member elects to have surgery, for instance, knee surgery, and they've chosen a provider on the PPO who's not affiliated with Harvard Pilgrim, and that is unusual because the network is so broad, most folks go in network, so it may never come up. But if somebody does elect to have surgery out of the network deliberately, they do need to call us in advance in order to avoid a $500 penalty for no prior authorization.
Hi. Woo. For Unicare, the Unicare plans, if you're having an elective admission, so again, a baby or a knee surgery, hip surgery, we do require a 7-day notification. Where that varies a little bit is on the Plus plan. The Plus plan, the hospitals are contracted with us, and part of their contract is to notify us of a member's admission. So the Plus plan is a little bit different. The hospital will notify us that the patient is coming in. It's their responsibility. In an emergency situation, we require a 24-hour notification. So if a member is admitted on an emergency basis through the emergency room, they just are required to notify us within 24 hours. It can be a family member. It doesn't have to be the member themselves, but we do require that notification.
Thank you. For elective admissions, if we're talking about having a baby, in most instances, because of a prenatal program we have, we're pretty much aware of what's going on with the member and kind of an estimated delivery date, so we're pretty good idea where they're going. The member is not responsible for getting an authorization to be put in place. It is the responsibility of the hospital, so there's no notification needed there. When it comes to an elective surgery, again, it's the hospital's responsibility to get the prior authorization and to notify neighborhood health plan. It's not the member's responsibility to do so. In the event that there's an emergency situation, as I mentioned before, if somebody ends up inpatient as a result of an emergency, it wasn't pre-planned, we would ask that a representative of the family or the primary care physician notify us within 48 hours of the admission so that we know what's going on.
Sorry, to clarify Health New England's procedures, for a childbirth or a maternity inpatient delivery, we don't need notification. But if they're elective or surgeries, some services do require prior authorization. The hospital does need to let us know. In an emergency situation, we do ask that the member or a member of the family notify Health New England that the emergency occurrence has happened.
So now we'll open up the floor for questions of the plans. Yes?
Health New England, are we covered when we're traveling out of the country? What is the coverage?
So the question is, emergencies out of the country, what happens?
Yes, you are covered when you're traveling anywhere outside the service area outside the country. As mentioned before, we do ask that you might have to pay for it up front, and you come back to the service area with a receipt, and we will have you reimbursed for the emergency room deductible and copay.
In general, isn't that true for all the plans? For the most part, you know, realistically, if you're in Guatemala, they're not going to recognize Harvard Pilgrim Healthcare. So usually, and I can attest to this, you get quite a bill. I remember we were billed $25 for a Band-Aid and $8 for the string to stitch up my son's chin, but you know, we were reimbursed, but we did have an itemized receipt and submitted it for reimbursement.
There is a matter sometimes also of currency exchange as well. So if someone's in France and they paid, what's the currency in France? They're paying in euros. It's whatever the currency exchange might be at the time that we're doing the reimbursement. So that's going to happen as well. So it takes a little bit longer to reimburse if you're outside the country, simply so that it can be so that the currency can be exchanged.
Just to add to that, it is good if you ask for the bill to be submitted in English. Yeah, it's good if it's submitted in English and the bills in the money owes in American dollars.
Other questions? Yes.
I want to go back to the in-network out-of-pocket maximum for the year.
Yep.
If a person changes health plans mid-year, who's going to be tracking that?
Okay, so the way this is going into effect is it's going into effect July 1st. So if somebody has already, let's say you're in Unicare Plus, you've already blown by that for some reason, very small number of people, you've already exceeded the $6,000 by July 1st, we're not going to reimburse you. The amount is going into effect July 1st. It is going to be a calendar year benefit, so it's going to work similar to the deductible in that if you change carriers next year, for example, if you were to change carriers next year, and you had already met the $5,000 with one particular carrier, you would be subject to new out-of-pocket maximum if you switch carriers. If you stay within the same carrier but switch to one of their other options, that calendar year out-of-pocket maximum will go with you. Does that answer the question? I know it's been a huge request to change from calendar year deductible to fiscal year deductible for both this purpose but also for the deductible. It's something we definitely want to do. It costs money. So we are trying to figure out how and when we could implement that, because obviously it's a barrier for switching plans mid-year. But that's to be determined in the future. Yes?
Does everybody have the same type of carryover deductible for the last 3 months of the year?
Yes, so the question is there a carryover deductible at the end of the year for services incurred in October, November, December? And the answer is yes, all of our plans do that. Yes.
Any thoughts of adding single plus one to your health?
All right, the question is single plus one. So what would happen to the family rates if that happened?
The people that just have one child don't really care. When you're
I
looking at the
understand that.
person.
I understand that, but the issue is that we have the policy we have to be family friendly. Those are the people that are going to the doctors and hospitals a lot because they have children, for example. Also, most of the 1+1 people are actually the people that are incurring the highest costs. So you've got your non-Medicare retirees and their costs blow away everybody else's. So we are sticking with our current policy. It's individual or family. Other questions? Yes? So the question is on chiropractic benefits.
Yes, Fallon does offer chiropractic benefits, subject to a copayment.
Tufts Health Plan offers 20 visits per year and an evaluation, and there's a copayment.
The same is true for Harvard Pilgrim Primary Choice and Independence Plan, 20 visits per year with a copay.
That is the same for Unicare as well. Unicare covers 20 visits per calendar year after the copayment.
NHP does not currently offer Chiro, but we're looking to possibly add that in the future.
Health New England currently does not offer chiropractic benefits, but we are considering for the future as well.
So that's a good example of, you know, if you have a particular need, that it's good to shop during annual enrollment. Other questions? Yeah.
Just wanted to confirm that UMass Memorial is now in the network for NHP?
Yes, it is.
Okay.
Yeah. The difference in the past 6 months is that the primary care physician network with UMass Memorial is no longer part of NHP. We do have specialists in all of the UMass Memorial hospitals, the 3 campuses in Worcester, Health Alliance, Clinton, those are all part of our network, but it's the primary care physician group, so we do have a large network of PCPs in the Central Mass area.
Some strange benefit that you want to know about? Yes.
I live in Greenfield, so I don't know who Greenfield is. So we're right on the border of like Vermont, southern Vermont, and eastern New York, and we're in Queens. So a couple of our employees live right over the border in areas of Vermont that are where the closest city is actually Greenfield, Mass. So they get their health care in Greenfield, Mass because it's the closest doctors to them. And they'd like to get the limited network because they have no doctors around them.
Yeah, but keep in mind, we're a Massachusetts employer. So our plans are purposely our limited network plans. You need to live in Massachusetts to be in a limited network plan. Yeah.
We just have quite a few of our employees notified that they've been in Harvard for many years, some that were new, but some have been for years and have already spent their deductible, and now they're being told where they live is not in the network. So what do you do with them? They're told they have to change.
Are they in New York?
One might have been in New York, I can't remember now, but they were told originally when they went in that it was a new network. One lady's been in it for a number of years and has already satisfied $750 deductible for her family. And now she's being told she's got to change.
The answer is that they can go from primary choice to independence and that they wouldn't have to satisfy any deductible.
They were already in independence and they're told that they're not in the network any longer.
Independence, where would they live if they wouldn't be in independence?
We, Harvard Pilgrim, are working to make sure that folks who are on any of our plans, whether it be independence or primary choice, live in the enrollment area as agreed with the GIC. So it may be that someone has been enrolled in the plan in New York, or perhaps they have gone through a divorce since they joined the plan. And this may not be the case in your instance, but for everybody's edification, let's say you've got a husband and wife who have become divorced and one of the spouses has moved outside of New England. You as the coordinator or the GIC may not know about where that former spouse lives, but they've alerted us because we're their health plan and they need to tell us where they live. Every month we run a report of folks who live outside of the dictated enrollment area, and if somebody does live outside of the enrollment area, they will receive a letter from us indicating you no longer live where you need to be on our plan, and this is not verbatim, as you can tell. It's a nice letter. It lets them know you don't live, unfortunately, where you need to be on our plan. Please get in touch with your coordinator so you can get yourself on a plan that will cover you. It's unfortunate, and it can happen to folks years after they've joined, if they've moved. And if they haven't moved, it may be that when they joined, we now pick up where a zip code, we pick up by zip code at this point. So folks could have gotten something.
Well, I remember you used to have coverage people that lived in New York, as if they worked for them. And then you let people that live in New York.
So again, start with a map. I always tell people start with that map.
Right.
If you live in New York, there's a couple of plans that show a little asterisk, which means not every zip code for sure. It's usually just the border towns. But I would highly recommend that if somebody lives in New York, they pick one of the ones that's not limited. But yeah. We've really clamped down on the service area, so that is absolutely, you have to live in the service area. So it's on each health plan page, and it's also on that map. So again, it's a great place to start.
I always keep in mind too, because they have to make this switch as of July 1, keep in mind that really what they're at risk for is those first 3 months, because the deductible in October, November, or December actually will roll towards even your next year's. So, I mean, that's another point to. So it will start out. So if by chance October, November, December, they're incurring those expenses towards the deductible, it will count towards their 2015 deductible. Keep that in mind.
Yeah. But that isn't, I mean, if you looked at expenses, July and August are actually the lowest healthcare dollar months. So if people can sort of eke it out till October, then they have that carryover. Yes?
If the North Adams Hospital were to reopen in some form, would folks change their plan?
No. No. So again, they want to take the advantage during annual enrollment. They need to look at because providers come in and out throughout the year. They can oftentimes the provider networks change on January 1st, and that's obviously well past annual enrollment. So again, they want to look to see if a doctor or hospital is in the network, knowing that they could leave during the year, and if so, they'd have to find another provider. I want to move us along because I'm aware it's already 11:25 and we still have quite a bit to cover. So the health plans will be here afterwards, and I definitely encourage you to introduce yourselves and ask them questions. I just want to cover a couple of quick things. These are the towns that are joining the GIC July 1st. We also have the North Andover, who is joining the retiree dental plan. And then the MBTA Carmen's Union, they actually joined last fall, but they're coming into effect on July 1st. I don't think there's anybody here that this affects, so I'm going to just go by that. So I do want to go over our website just to help you navigate it a little bit. I strongly encourage you to use our website. There is a wealth of information on our website. We have over 1,200 pages of our website, so it is a bear to keep it up to date. But we have updated everything for annual enrollment. For you, I want to make sure that everybody here is aware of the coordinator section of our website. As you all know, last year we came out with new coordinator manuals. And of course, as soon as we printed them, they were out of date because DOMA was overturned in June, literally right afterwards. And there have been some other changes that have happened since then. So if you come to the coordinator section of our website, the coordinator news, great sections to start with. News for this year's annual enrollment. This includes the procedural manuals that are in the packets that you received today. The coordinator training sessions are these sessions, the schedule, where everything was, the RSVP form. We will be posting the presentation here along with audio. Health New England is offering a breakfast meeting, and that information is here. If any of you are state agencies and are wellness champions, all of the information that you need to administer some of the various challenges are there on our website. As you know, in the fall, because of the Affordable Care Act, you're now distributing a marketplace notice to all new employees. And so that affected the new hire section of the manuals, and it replaced the HERD form, and I'll be talking about what we're doing in regards to that. But the biggest section that I would hope that you would take advantage of are these procedural manuals. So these are always right up to date. There are 3 different versions, HRCMS and UMass, municipal, and offline agencies. So you'll see here the downloads are available, but we do include warnings about what's out of date on that. But all of the other changes are right up to date. So, for example, if you saw our winter newsletter, we are now saying that in many instances, folks that are laid off or leave service are often better going through the connector than through COBRA. So if you click on here, you'll see this was updated on March 20th, and you will see that the first option we're recommending is now the connector, whereas in the past it might have been COBRA. So again, all of the step-by-step procedures are available on our website to administer GIC benefits. It's sometimes hard to navigate our website because we're under the umbrella of A&F, but it is a little easier than it used to be. In that there used to be this fly down menu, and every time you'd have to move your cursor away to get back where you were. But what we've tried to do to make it easy is include a link to our homepage so you can always start at the beginning again to get where you need to go. One section, I didn't show you under the coordinator information section is supplies. So ordering supplies, if you want to order provider directories, all of the information is right here, emails, phone numbers, and that's for all benefits, health and other benefits. Make sure you indicate how many you want, or otherwise you could get 10,000 boxes delivered to you. So definitely tell them how many you want. So back to our home page, another section that's very helpful are the form sections. So these are broken out by who you are. So for the 3 new municipalities, all of their forms are grouped together. Active state employee forms, retired state employee forms, existing municipal forms. And you'll come to this and all of the forms you need. So we'll be talking about the optional life insurance open enrollment. It's the number 2 form on the active state employee form section of our website. So again, forms are grouped by who you are. One of the most frequently used sections of our, let me show you not the newsletters, but the benefit decision guides. All of the content of our benefit decision guides is on the website. So if you're an active state employee and you clicked here, all of the pages of our guide are pages on the website. So benefit changes, links to the health plans. Here's that limited network plan page I mentioned that has the grid that you have in your packet, the rates, etc. So that's all under the benefit decision guide section of our website. The most frequently used section of our website is answers to FAQs. This is a phenomenal resource. Please, please, please refer your employees to this section of our website. So if an employee has a dependent age 19 to 26, all of the questions and answers about that are there. Divorce, legal separation and remarriage, employment and eligibility, family status changes, etc. You can see it. The number 1 question that we get at a health fair is, I'm turning age 65, what do I need to do? Everything they need to know is on this page. You can see it was updated on March 27th. Please refer your folks that are turning 65 to this page. There's also a retirement FAQ section. There is a huge uptick in number of retirements. I'm sure we're seeing it, you're seeing it. Anybody that's retiring, make sure they look at that retirement FAQ section of our website. So we are really excited today. The Hartford is here, and I'm going to call them up in a few minutes, but we are offering our first special life insurance open enrollment that we've offered in the last 10 years, first time in 10 years that we're offering a life insurance open enrollment. This is going to run longer than the regular annual enrollment like we did with LTD last year. So it starts April 9th and it's going to go till June 13th, and the coverage will be effective on October 1st. There is no medical requirement as long as an employee, and it has to be an active state employee, is applying for 1 time, 2 time, or 3 times coverage for the first time, or they're increasing their current coverage. So let's say they're already enrolled in 4 times coverage, they could increase to 5 times, 6 times, or 7 times coverage. But But under this open enrollment, there is no, you need to elect a multiplier factor, and I'm going to show you the form. Another thing to know is that the accelerated life benefit is being enhanced as of July 1st, so that in the event that somebody has a terminal illness, they have 12 months or less to live, they can, and they elect the accelerated life benefit, their premiums will be waived. So this is the special open and life insurance open enrollment form. You can see these are the options. So I'm not enrolled and want to enroll for optional life and agree to an automatic increase as my salary increases, 1 time, 2 time, or 3 times. Or I am not enrolled. If I'm not enrolled and I don't want automatic increases, the only option is the 1-time salary. Or I am currently enrolled and I want to increase my multiplier by 1 times, 2 times, or 3 times. If a person does not want one of these options, they use the regular Form 1. So if they use the Form 1, they will be subject to evidence of insurability, because we don't know they're applying for the special open enrollment. So the guide tells them they need to use this form if they're enrolling during this special open enrollment. The form is on our website.
It's in the packet.
And it's also in your packet.
Cindy, if someone has been declined,
They can enroll.
so it doesn't matter.
Right. Question is, if they've been declined in the past, can they enroll? And the answer is yes. Yes.
Let's say someone a week ago filled out the Form 1, and now this is available. Is there a way to say, forget that Form 1, I want to go with this?
No, it's already in the bucket. I mean, you know, if they're declined, then they can just apply during the open enrollment.
Right.
Cindy.
Oh.
On the first line of the special life insurance, it says if you're already enrolled, you can go up to 6 times, but on the form, it only has 3 times salary.
And that means that you're already at 3 times?
You're at 3, so you can add 3 to it.
Okay.
It's giving an example.
So you can only
So,
go up to 6, there's no...
no. So if you were at 4,
Yep.
you can go to 5, 6, or 7.
Yep.
If you were at 5, you could go to 6, 7, or 8.
All right, so this is more of adding.
Right. It's a little confusing. That's why we gave the example.
Adding or enrolling for the first time without a medical evidence.
Okay. Thank you.
Yes.
And this is for only state employees, right?
Correct,
No
active
municipal?
state employees. So in addition to our regular health fairs, the Hartford will also be offering some mini fairs at state office buildings. And if you have a lot of employees that you think might be interested, please see Katie today to ask her about having one at your location. So she has some posters out here for you to post and this fair schedule is on our website. So if you go under the benefit decision guides or you go into the health fair section, the mini fair schedule is on our website, and these are where the Hartford will be in addition to our regular fairs. Yes?
Will there be any mini fairs in December?
Yeah, so the question is again, see Katie today. If you feel that you have a lot of state employees in this area that you want to have another fair, please see Katie today. And I'm going to have Katie come up here and speak to some of the benefits about the optional life insurance program that you may not be familiar with. So obviously optional life insurance is a death benefit. If you die, your beneficiary is paid. But there are other aspects of the life insurance program that you may not be familiar with, and I'm going to have Katie, who is our new account executive for the Hartford, discuss some of these programs.
Hi everyone, my name is Katie Devon. Can I just use this one? And I am the rep at Hartford Life. We have the life insurance and the accidental death and dismemberment for the Commonwealth employees. And I just want to take a second to reiterate what Cindy said about the open enrollment this year. This is a great opportunity to get into the plan These don't happen very often. It might not ever happen again even, but if your employees need additional life insurance, they should come into the plan at this time. So I want to tell you about a few of the features on the life program that you might not be so familiar with. And the first three are actually provisions of the policy. The first is portability, and portability for life insurance is like COBRA is for medical insurance. It allows terminating employees to continue their life coverage at the same cost that they paid as active employees. The difference with COBRA is COBRA typically will end after 18 months or 3 years, whatever. As long as you pay the premium for the portability policy, you can continue this up to age 75. But there are some limitations. First of all, it doesn't apply to retirees. It's only meant for active employees. The amount that you can port is a minimum of 50%, but it can't be more than 5 times salary or up to $750,000. So if an employee has more than $750,000 that he wants to continue, he can get the rest of it under the conversion policy, but it would cost a lot more. Portability is a lot less expensive. But the third thing, probably the most important limit on this, is that the employee must apply within 31 days of his coverage terminating. There is one exception to this. The Hartford sends out conversion and portability notices to terminating employees, and if the employee gets that past the 31 days, we'll accept the application up to 15 days from the date that the notice went out, but not longer than 90 days. Important thing for you to know, if you have a disabled employee who's terminating because he's on LTD or permanently disabled, he should really apply for premium waiver, because that would take away all of his premium and continue his coverage. And then the next benefit is the accelerated life benefit. And that allows employees who are terminally ill to access their life benefit ahead of time. And terminally ill is defined as being diagnosed with 12 months or less to live, as evidenced by a physician. And a terminally ill employee can take between 25 and 75% of his life benefit ahead of time, and then the balance will be paid to his beneficiary at time of death. He can only access this one time, so he really needs to know how much he wants to take up front. And an important thing to know is that this will be taxable to the employee. Because there hasn't been a death yet, it's not really a life insurance benefit. It's received by the employee as income, so it will be taxable, whereas typically a life insurance benefit's non-taxable. And then the next benefit is the accidental death and dismemberment benefit, and this is paid if there's loss of life or limb due to an accident. And if it's total loss of life or serious loss of limb or use of limb, the 100% of the life benefit will be paid. And then there's lesser benefits paid for lesser injuries, 75% or 50% or whatever. There's also benefits if due to the accident the employee went into a coma or had brain damage during the subsequent year. There are benefits payable. The key on this benefit is that the claim must be filed within 365 days of the accident. And one thing I wanted to mention was the felonious assault benefit that the Commonwealth has, because this is an unusual benefit, where it will pay 3 times the additional, 3 times the life insurance amount if the accident's due to a felonious assault, which is defined as while you are engaged in on the business of the Commonwealth and you suffer a criminal act of violence that includes but is not limited to robbery, theft, hijacking, sniper attack, murder, assault and battery, or civil disturbance, you get 3 times your life benefit paid. So you get it paid once on the life, once on the AD&D, and 3 times on the felonious assault for 5 times total, which is really good. Now those are all policy provisions. The other 4 things are services attached to the life insurance. So anybody who has life insurance has access to these other services. And these are primarily online and telephonic services. The first is funeral planning assistance, and this is through our vendor, Everest Funeral Planning. And they have a suite of online tools that allow you to do several things. First of all, the employee can go out there and plan a funeral ahead of time. He can plan his own funeral and put his last wishes on the site, or if he's planning a funeral, it gives him things to consider. But I think the best thing out on this site is that they have a cost comparison tool. And Everest has the only nationwide database of funeral home costs throughout the country. So the employee would go into the site and put in a zip code and put in an area like 5 miles or 10 miles. And all the funeral homes in the area would come up, and you can select the ones you're interested in. And the site will prepare a graph for you comparing the costs of all the funeral homes. So in preparation for today, I did Amherst. I put it out there, and I selected 8 different homes in 10 miles. And the cost differential was over $2,000 from the least expensive to the most. So that can be very helpful, you know, while the employee is looking into that. In addition, Everest also provides licensed funeral directors who get on the phone with the employee and help negotiate the rates with the funeral home director that you provide. So it saves money and stress, you know, during a hard time. And the next benefit is beneficiary assist. And this applies to your named beneficiary at time of death, or it can apply to the employee if he's had an accidental dismemberment claim. So the loss of a loved one, you know, besides the emotional issues, there's many other issues that come up, financial issues, legal issues, etc. So this program, provided through our vendor CompPsych, provides telephonic access to 3 different types of professionals: grief counselors, financial planners, and licensed attorneys on an unlimited basis up to a year. And while EAP programs, you know, cover employees, sometimes the beneficiaries are not covered, so this would apply to the beneficiaries during that time. They also allow 5 face-to-face visits with local counselors, attorneys, or financial planners under the program. And also provided by CompPsych is our estate guidance program. This is an online will prep service which allows an employee to go online into the estate guidance site. You put in your state of residence and a bunch of questions come up. The employee answers all the questions, and as he's going through, if he doesn't know how to answer something, they have access to online attorneys who can help answer them. And then when they're done, you press a button, it prepares a will for you. You can print it out, sign it, have it notarized, and you have a legal and valid will in your state of residence. So it's all for free, so it's a great benefit to have. And the final benefit is our travel assistance benefit, and that is provided through our vendor Europe Assist, and it's emergency travel assistance service. It applies to employees, their spouse or domestic partner, and children up to age 26 who are traveling 100 miles or more away from home for 90 days or less. And there's 3 types of assistance: medical, emergency, and pre-trip planning. The key thing to know about this service is it's not an insurance product, so you don't incur the cost and then submit the bill. You have to call them first, and then they'll arrange the services. But what they will do is, for pre-trip planning, if you have questions about the visa or passport requirements, or inoculation or immunization requirements, travel advisories, or foreign exchange rates, they can help with all that. And for personal emergency assistance, if you're overseas and you lost your wallet and needed cash, they could loan you cash on an emergency basis up to $500. You have to pay them back, but they will get it to you quickly. They'll help with lost luggage, emergency travel arrangements if you're stranded somewhere, and also bail advancement if someone lands in jail. But the primary thing that they do is their medical assistance program. So if an employee or family member becomes injured or sick while they're traveling overseas, you would call them up. They would assign a medical case manager to you. The medical case manager would find the best local facility to treat the employee or dependent. They would move them there. If the employee was in critical condition or in the hospital for 7 days or more, they would fly a family member or friend over to be with the employee. If you were traveling with young children and they had to be transported home, they would arrange for them to go home with a suitable escort. If you needed to go home, if you were so sick you needed to come back to the United States or it was going to be a long-term care, they would bring you back over. And even if someone died while they were overseas, they would arrange to have the body brought back to the United States. And I've actually seen them do this in a couple of different instances, and it's a wonderful service to provide to employees and their families. You know, no one knows what to do at a time like that, and they take care of that for you. So all of these services are available now to your employees as long as they have life insurance. The 800 numbers, the websites, and the codes that you might need to use for anything are all on the GIC website. Cindy has them all out there, so they just need to go in, and you should just be aware of these so you can recommend them to your employees. So, any questions or later on?
We have only 5 more minutes, so I'm going to have, Katie will be in the hall, so if you have questions about the life insurance benefits, please see her and also introduce yourselves, and she can get you additional supplies. Paul, did you want to mention anything? No? Okay. LTD, the mental health benefit of the LTD program is being enhanced as of July 1st for disabilities that occur on or after July 1st. It'll now be a 36-month benefit. The rates are going up slightly to cover that. The WellMass pilot program is continuing. Lunch and learns. Contact Ashley if you want to have a lunch and learn at your state agency. There's a discount to Boston sports clubs, and there's going to be a Hubway bike program discount coming out soon. The member survey, anybody that was on the state's listserv got the member survey over this weekend. I also sent it to higher ed to forward to your employees. The home mailings that went out all have a member survey if you're not one of the agencies or municipalities that I mentioned in that email. My GIC, please, almost everybody's been rolled out on the My GIC platform. Almost the only folks remaining are some of the offline agencies and the brand new municipalities that are joining July 1st. But everybody else should have received in the mail their PIN for the My GIC website. This is a great resource. It allows employees any time of day to look up their benefit statement, to see how much life insurance they have, which is helpful during this open enrollment, so they can check online on this website and say, oh, I'm enrolled in 2 times, because nobody remembers what they enrolled in. So please refer them to the website, and it's a great resource. Oh, yeah. Retirement, please remember when you have people retiring, and again, we've got this huge influx, huge bump up in number of people retiring. To refer somebody that's retiring to our website, to that FAQ section I spoke about, but also if you're from an active state agency, refer them to our website to see the retiree guide so they can pick their Medicare plan. The municipal guide has that information in it, but there's a separate guide for retirees from the state. Make sure that you instruct them to go to Social Security if they're 65 or older to find out about Medicare eligibility. And make sure that the employee that's retiring has elected their Medicare plan on that Form 1 or Form 1 MUN that helps expedite that enrollment process. Another thing for the state agencies, please, please, please make sure that your people that are retiring that have optional life insurance, let them know that they really need to look at that, because the cost goes as soon as they retire. And the rates are on our website, so refer them to our website for those rates, because what'll happen is they're going to get this humongous bill and they're going to have to pay it. So please make sure you let them know that's the time they really need to evaluate whether they really need optional life insurance. Usually if somebody's retiring, they've paid off their major debts. They don't have any more student loans. They don't have their mortgage, usually. Otherwise, I don't know, they're not expecting to live very long, I guess. But just please make sure that they look at the cost of optional life, because usually they should at least decrease how much they're carrying. It's just a death benefit. It is not a whole life policy with a value to it. Retiree dental, please, if you're one of the 13 participating municipalities or your state agency, please let the person know about the retiree dental program. MetLife does do mailings when somebody retires, but there's usually a lag and whatever. Make sure they know about the retiree dental program and suggest that they compare it with the COBRA option. Oftentimes the COBRA dental they may have through their union is a good deal for 18 months. Do that for 18 months and then come on to retiree dental after that 18 months has expired, or they can come in during annual enrollment. Paul, I'm going to have you talk about terminations, because I know you love it so much.
What can you say, other than the termination? What we're bringing up here is we bill about 3,000 people monthly off payroll and 6,000 people quarterly for their insurance. We terminate about 250 people per month for non-payment of premium. What we are finding is that since we allow a one reinstatement, only one if you terminate for non-payment of premium, the rule says you have to come in during open enrollment. So they get a one-time deal to reinstate, pay back all the premiums that they owe, the forward month also for deduction, or they have to come in during open enrollment. That is going to be the rule temporarily. Right now is what we're going to allow. But many people are ignoring the bills. Something happens, they want to get reinstated. They're finding that when they call us, they're going to say, well, why do I have to pay back the premiums? Well, we have to pay the life insurance, we have to pay the health carriers. So what happens is they ignore the bill, and when they need it, they want to get reinstated. So we have a rule, one-time reinstatement only for non-payment. If you terminate again, you're out till annual enrollment, and that is going to be our rule for people that terminate for non-payment of premium. But they've got to pay back all of the premiums they owe. And on that note,
So if you have people retiring or people that are going off payroll, please make sure you tell them they're going to get a GIC bill. Give them that warning and tell them they've got to pay it. So as coordinators, please keep that in mind. That's really on the state side. No munis.
And they will always get that bill monthly?
Yeah.
well, it depends.
Some are quarterly. Survivors are
Two ways.
quarterly.
There are people that are off payroll in the state HRCMS payroll system. Some people don't report the leave of absence. So what happens is our system will treat it as a missed deduction and bill them after the month is over. For people that are on a leave of absence, we will bill them a month in advance, and they get that bill every single month. After 60 days, they terminate for non-payment of premium. A retiree, what happens when they retire, when they leave their agency and when their pension begins, is usually a 2 to 3 month lag before their pension kicks in. We will bill them at home for all of their coverage for those 2 or 3 months. When the retirement board notifies us of the approval, we will stop the bill and take the deduction from the pension check, and it must come out of the pension check.
My husband just retired a few weeks ago. We got a bill from the GIC yesterday, and I was like, looking, and he was going to call his guy, and
Many people think that they get a bill, they say, oh, this comes out of my check. This will come out of my pension. They'll make this up later on. That is not the case.
you're not getting the retirement check.
Right. When you get a bill, pay the bill. Many people are ignoring the bill. So that's why we're trying to bring this up. If you know they're off payroll, gonna retire, miss a deduction, we're gonna bill them, they must pay it, or they're gonna lose their insurance.
And the connector has told us that they're not eligible for connector coverage. Because they're eligible for us, they're not eligible for the connector. They haven't paid their bills. They need to pay their bills, and they could be without health insurance until next July 1st. So again, make sure you tell your people that are retiring, they're gonna get bills, they've gotta pay them.
And what's going to happen when they do their taxes, if they're not covered for more than 10 months, they're going to be penalized on the federal side for not having insurance.
Let's take it home.
You're a good dude.
Because it's kind of associated, I think, in the chart, and I know because of time, can I talk to you after?
Yeah, you can talk to us after. Basically what it is, if you have an employee off payroll for more than 1 year, on month 13, if we're still billing them, the state is going to charge back the 85 or 90% contribution to the agency's budget instead of GIC paying that on behalf of the employee. That's if they're 1 year.
One, how prominent, you talk about the numbers, how prominent is that? Two, why aren't they just dropped? And three, if it's like a workers' comp issue and they end up getting partially paid, why don't their billing stop and they revert to having the deductions come out of the check?
Well, first of all, if they're on leave of absence, we have no jurisdiction. It's up to the agency to approve that leave. If the agency is approving that employee to still be an employee, they are still entitled to benefits. If the employee is no longer associated with that agency, people that are out on workers' comp can be terminated as an employee. Their workers' comp will continue, but their employment status with GIC will then end. GIC will not make any determination on employment status. So if people are out on leave, getting a bill, that's between the employee and the agency. Unless they terminate that employee, we will continue to offer them benefits. GIC will send them the Form 11, which allows them to pay the rate that they would normally pay if they were at work to continue that part cost premium. What happens is the Form 11, for many of you that don't know, allows the employee to continue their group insurance benefits at the rate they would pay while they were working, if GIC approves the form. The form can be approved based 1 month, 2 months, no more than 6 months. The doctor has to tell us how long the employee is expected to be out of work. It could be 1 month. We will bill them 1 month, and they have to get a renewal Form 11 on their own. It's not up to GIC to do that. Every employee on leave of absence, if it's due to a medical, industrial accident, maternity, we have to bill them. And they need to do the Form 11.
If someone had mass health and they were canceled, I have an example. She had mass health and it canceled in December. So she couldn't get back on mass health, but her children could. She said that she would have to pay $120 a month for her children. She came to see me and she wanted to get health insurance. Would she have to pay the back premium from December until now?
The question is, someone lost their mass health eligibility. Loss of coverage is an eligibility that we allow people back into group insurance. If somebody is losing their coverage outside of the Commonwealth, involuntary through no fault of their own, they can come into GIC coverage with proof of loss, and they come in prospective.
Right, but I'm saying so like a 3-month span that all of a sudden she comes to me 3 months later and she lost her health insurance in December and now she wants to take her health insurance.
There is a time frame that people are allowed to enroll if they lose coverage. Usually within the first 31 days from loss of coverage with proof, GIC will let them back in. If they come to you 4 months later and say, hey, I got this letter 4 months ago, I lost coverage, we're most likely going to tell them annual enrollment. It's too late. So there are some deadlines, but there are also some timing issues with when they were notified from the carrier who had the coverage. We have to look at that. But normally it's 31 days from loss of coverage.
Do they get penalized at the end of the year for that?
If they don't have insurance, they're going to get penalized by the federal. That's outside our jurisdiction. You know why I didn't want to talk about termination?
So I just want to quickly point out, these are some areas, especially on the Muni side, that we are having difficulties with all of these sections being completed. So up here, make sure that they are filling this information out. This is the number of hours they work per week, whether they're in a public retirement system, their date of hire, that the person has signed and dated it. And you'll see active employees give it to you, retirees return to the GIC. So please, please, please make sure employees and you are making sure these forms are completed accurately, comprehensively, otherwise the effective date will be delayed. This is the IDF form, and I'm just giving this as an example. Same thing. Somebody wants to add their spouse or their kid to coverage, please make sure that the documentation is attached. Or, as Paul mentioned, if there's somebody involuntarily lost their coverage on the Form 1 or Form 1 MUN, they want to join, we need that proof of the involuntary loss of coverage elsewhere. Same thing with kid or spouse. On the child side, if you have a newborn, the hospital notice is fine, and that's in your manual. So make sure that that is attached to the IDF so that the kid can be added to the coverage. You want to add to that, Paul?
Just one thing, we're finding that more and more, we're getting enrollment forms in with missing documents. So some people are just sending us the forms, and we're holding the forms to say, well, will the documents come back in? We have no idea. We have no idea if they're going to come in. We get 10,000 pieces of correspondence per week. All of a sudden, we get a marriage certificate appears. We have no idea who it is on that marriage certificate. We can't match it. A birth certificate, we can't match it. There's 440,000 people in our system. And if you get a marriage certificate for Paul Murphy, we have no idea what to do with it. So we just want to encourage everyone, if you don't have the complete material, just tell the employee, I will send it in when you get me the complete material. Because it's only going to delay the effective date, and most likely the coverage isn't going to go into effect because we don't have the right documents and we can't match many pieces of paper that come in. We have no idea who the employee is.
And I just want to point out on Form 1 and Form 1 MUN, we now have a decline box, and that's for your new employees. What happened is last fall, that new marketplace notice took over the HERD form, but there's no signature on file for you to know that the person declined coverage. So at least for your new employees, this will protect you. We don't need, if they're declining GIC coverage, we don't want this form, and this is in the manual. We don't want the form, but keep this in the employee's personnel file so that you know that they declined the coverage. So as you know, all new employees need to get that marketplace notice. That's a new requirement under the Affordable Care Act, and that is also in the procedural manual. Your employee acknowledgement form, you need to make sure your employees are signing that and you're giving them a copy because that has that SBC address on our website. Those are the summary benefits and coverage, which are required documents for the employee to know about. It's a way of displaying the information for each of our health plans. So the website address is on there, and it was in that home mailing that we just sent to the house. I mentioned earlier the Health Connector is usually a better option than COBRA, so the employee should be doing their research when they're leaving service or laid off. And the retiree dental forms have changed, so be sure that you're using the one on our website, which is the most up to date. Turning 65, most frequently asked question, what do I need to do? If the employee, the insured, is still working, he or she does not enroll in Part B until he or she retires. And the same thing for the covered spouse. If the employee is still working, the covered spouse does not sign up for Part B until the insured retires. Again, all of this information is on our website, but this is the most frequently asked question we get, and I definitely encourage you to be familiar with the FAQ section on our website. Many of you know Winnie, and she is also going with the herd of people that are leaving service. Unfortunately, she's been a tremendous asset to the GIC. So when you have coordinator address changes, email changes, you're shutting an office, you're moving your location, your phone number's changed, or you have your discrepancies, there's a new coordinator email address. This is also on the coordinator manual section of our website. So it's coordinatorchanges@massmail.state.ma.us. When you have those changes, please be sure to include your agency division number. We have over 900 agency divisions, and it really helps us expedite. Everything is by agency division number in our system, and it makes it a lot faster for them to update Magic and update our email lists. The other news is we are out to bid for the FSA vendor. We'll have more information on that this summer. And we're also out to bid for the prescription drug vendor for the Unicare plans. That would be for next July 1st, not this July 1st, next July 1st. So those procurements are in process. Benefit decision guides, the shipments have started. All of the municipal shipments will be completed by today. All of the agency shipments will be done by the end of this week. The retiree shipments are happening now. All of the content of the guides are on our website, including the downloadable guides. The health plan websites, they will be ready by April 4th, and that's all of the provider directories for July 1st. Make sure that when you're on the website, you're making sure they're for July 1st, because those do change every July 1st. We're going to have sign language interpreter services at the Transportation Building and Quinsigamond health fairs. That's on our website. We have a TDD, TTY phone number at the GIC, so if you have somebody that needs those services, please have them use that phone number. Our website, all of the content of the guide is available on our pages of our website, so they don't have to download the pretty guide. They can view all of that information on our website. It's ADA accessible. We have a number of languages spoken at the GIC, and so if you have an employee that English is a second language and they really want to speak in one of these languages, have them call the GIC, and somebody at the GIC can help them. The QR code on the posters directs folks to more information on our website. You can follow us on Twitter. We're tweeting a couple of times a day, news on the GIC, and we've talked about EIP.
All right, my name is Sue Cooper, and I now am the EAP response specialist for Beacon Health Strategies. For the last 15 years, I worked for United Behavioral Health. I don't know, EAP something, coordinator. Basically, my job has stayed the same for the last 20 years. So the following services I provide. Any supervisor or manager in the Commonwealth can call me directly for a consultation about any workplace issue that they're experiencing. It's free, it's confidential. They don't have to call their manager to get permission. They can just call me directly. It's a pretty popular service for people to get some support and guidance on how to deal with an employee they're supervising or some kind of workplace issue. And sometimes we talk on the phone. Many times I will go to someone's office. I've been to every Starbucks in the state. And next year I did talk to Dolores about Bermuda. So we'll see. Any questions? What?
Don't hold your breath.
Yeah, right. Any questions on that particular service? Insurance does not come into play here. It doesn't matter the insurance of the supervisor who calls me. It doesn't matter the insurance of the employee that they want to talk to me about. Insurance does not come into play. I can provide wellness seminars at anyone's office, building resiliency, stress management, managing change, improving communication, any of those topics and more. Again, there's no fee. I come to your office and present on whatever topic you think the staff might benefit from. I also provide grief support. Let's see, in the last 3 months, I've provided grief support to 3 separate agencies for unexpected deaths of state employees. You can imagine how devastating that would be for coworkers, so I go in and provide guidance and grief support. I'm also a critical incident responder, so if there's a traumatic incident in the state, a suicide, I was pretty busy after the bombings. I was living in Weston at the time. We were not locked down, which was good because I had to go to Hingham to do a debriefing for about 25 DCR people who had known one of the women that had died in the bombings. So even if we had been locked down, I would have found a way to, I could talk, dog off a meat truck if I had to. Any questions about my particular role? The state is my client. I work for Beacon Health Strategies. And again, there's no cost. I don't even ask for food. No one has budgets. I'm a licensed clinical social worker, and in the back of your handout is my email and my phone number. So please call. I'm never there, but call. Or email me, and I will get back to you immediately.